Good morning. Can you hear me? Good morning, PEFI. Can you hear me? Good morning. Good evening to Physical Education Federation of India participants. At the outset, I would like to thank Piyush Jain and the other members of Physical Education Federation of India for this wonderful initiative, especially during this time of lockdown when people are all inside the homes and unable to train and go after the normal activities. So, in fact, I'm Dr. Dobson from Chennai. I'm a sports medicine and exercise science specialist. So today I'll be dealing with an important topic which will be very useful for the physical education fraternity. So this topic is going to be on how to train an elite athlete. Okay, so this is an important topic which is going to be a collaboration between Physical Education Federation of India and Indian Society of Sports and Exercise Medicine. Okay, so Indian Society of Sports and Exercise Medicine is a new association which has been formed primarily by sports medicine doctors. Okay, so doctors who have finished their MBBS and then specialized in MD and PG diploma in sports medicine. All right, so let's jump into today's topic. Again, I would like to congratulate and thank Mr. Piyush Jain for this wonderful initiative. Let's jump into this topic of how to train an elite athlete. Okay, so first, before going into the depth, what is an elite athlete? So elite athletes predominantly, I'd like to also give a small gist that I myself is a professional athlete who had taken part at the national level sporting competition. So this is something which is of a very important and a passionate topic for me. So elite athletes are somebody who have a particular potential. Okay, so this can be right from young age. So the young age, even school athletes whom you will be directly dealing with, or an college level athletes. So for especially for physical education directors, I look at two important roles. One is talent identification. So this talent identification happens primarily at the level of schools. Okay, so the young talented athletes has to be spotted, and predominantly this is a job of a qualified physical education director. And the second, once you spot the talent, you train them and then develop the talent. So predominantly the second role after talent identification is developing the talent. So that talent development, talent identification, second one is talent development. Talent development predominantly happens over the age groups under 15, under 18, and then over to the college level. So that is how you develop, spot a talent, identify a talent, and then develop the talent. So elite athletes, if you ask me the definition, are they have a particular potential and they respond extraordinarily to training to unlock and okay, so how do you train these particular athletes? So when it comes to training an elite athlete, you have to look after some basic principles. So there is art and there is science. So what do you mean? Why this topic of art and science? So there is a subtle difference between art and science. One is when you talk in terms of art, you're talking in terms of quality. Okay, so a coach spotting a good cover drive by a cricketer is that technique can be spotted qualitatively because the coach or a physical director has already played that sport at a good level, and so he is able to spot the good technique. So that is what we call it as qualitative analysis. The other one is science. So when it comes to science, it is called quantitative analysis. So there is qualitative analysis, there is quantitative analysis. So what do you mean by science of training? So when it comes to science of training, it is very important for physical directors. Okay, so for you to be well tuned to the updates of sports science and exercise science. So I would like to start with the basics of training an elite athlete. So when it comes to any particular sport, the first principle for training an elite athlete is going to be specificity. All right. So there is a mnemonic you can all note down. It's called SAID. Specificity, adaptation to induce demand, and then development. Okay. So specificity, what do you mean by specificity? So suppose you're training a particular athlete who is going to take part in running a long distance, or suppose you're going to take he's going to take part in cycling events or a long duration event. You need to train him in particular way that athlete is going to be cardiovascular. The endurance wise he is going to be good. Okay, so that is called the metabolic demand. And the second one is going to be of short duration. Suppose the athlete is going to take part in durations which are very less. Suppose it's going to be on a sprinting event, or is going to take part in a weightlifting event. So you have to train them accordingly. You can't train a sprinter similar to you can't train a marathoner. Okay, so specificity for that particular sport is very important. Second one in the principle of training is going to be adaptation. So once you start the training, there should be a progressive overload. Okay, so if you just keep on giving the same type of training, same duration of training, then he's going to hit a plateau. Say for example, he's training for a long distance event, and you are pushing him only for a particular time frame. You have to progressively improve his timing. Okay, so progressively improve the duration of his timing. So these are all important principles you need to be aware about it. So second one, I would say the important principle is progressive overload. Only if there is a progressive overload, the performance becomes improved. The third one, I would say, is a very important principle, what you call it as periodization. Okay, so this is something which I would like to highlight, especially for elite athletes. So when it comes to periodization, look, at this times of lockdown, whole world is currently stuck up, and especially the professional athletes and the elite athletes who are used to training 4 to 6 hours per day are all stuck up in the homes. Okay, so how do you give them a this is an important time frame in the career which they are missing. Okay, so that is so when I talk in terms of periodization, this is the third important principle. So periodization deals with off-season training and in-season training. Suppose, so this is an off-season. Currently, no competitions are happening, no tournaments are happening. So all the athletes are currently in the home. They are not able to train. They are not able to train the normal ways which they will be training. So here, a good trainer or a good coach should be smart enough to give home-based training programs so that their athletes are able to handle so that the athletes are cardiovascularly fit and they are able to maintain their fitness level. Okay, so periodization deals with periodization can be splitted into 3 components. It's called microcycles, mesocycles, and macrocycles. So basically, if you are having 6 months before an event, then that is a good duration for you to train him, and you can look after all important components of his fitness training. If it is going to be only a smaller time frame, say for example in IPL and all, the athletes are constantly traveling. Okay, so they're not able to have adequate recovery. So recovery is one important component in principle. So recovery is something which you will have to really focus on it, because otherwise you keep on training the athlete, and then the athlete gets overtrained, okay, and his performance comes down. Especially for elite athletes who are going to have a long season, okay, so year long they will be training. So for them, the charting a periodization program is very important. Okay, so this is something which I like to highlight. So please note, the first principle is specificity, second one is progressively you'll have to overload them, and third one is periodization. Okay, so in this periodization, again I would like to highlight some important things. Just excuse for a second. Yeah, look, we are all in the middle of a lockdown right now. So after Corona gets over and the season gets restarted, okay, so how do you go about it? Okay, so always remember some of these important steps. First, always start with the training for the outdoor sport. Okay, don't straight away start the indoor sporting activities like table tennis, badminton. Those are all indoor events like gym. These are all things which you need to push it once the corona completely settles. So I would like to advise the athletes can start outdoor training first before going for indoor training. Again, at this time of corona, please instruct the athletes not to go do any high intensity training. Okay, so the athletes are usually used to do 4 to 6 hours of hardcore training, whether it's resistance weight training or whether it's training the cardiovascular component. But at this point of time, it is advisable to reduce the workload and look after the recovery part. Okay, so that way you will have to, so the intensity and the duration both has to be reduced at this point of time. Okay, and now one more important question. So if you are if you one of your athletes sometimes they get corona, okay, and if they are and they recover, how do you bring them back into the sport? So that is called return to play. So just like an athlete gets injured and he returns to the playing arena, similarly after corona, for returning to play, you will have to do a medical screening. Okay, so a medical doctor screening is very important, especially the cardiovascular status, his heart rate, his ECG, and preferably an echocardiogram has to be done before the athlete is put into competition levels. Okay, so these are all some of the important tips which you can take as far as the COVID-19 or corona is concerned. Okay, some of the other important components I would like to stress, especially for training the elite athletes. Okay, so as I started with, the physical directors has an important role in nurturing young talent. Okay, so this is where the young physical directors has to spot, they have to spot the talent, and then they have to develop. So there are certain important components you like to don't allow the athlete to young children to specialize in one sport. Okay, allow them to play multiple sport, especially at the early pre-teen level, 9 years, 10 years, 11 years. Those are all the time when young kids will be pushed into individual academies and professional academies. I would encourage all the young athletes to be playing multiple sport, unless there are exceptions, certain exceptions, like suppose if the athlete wants to take part in gymnastics, then it is very important that they specialize at an early stage. So these are all certain important things you need to understand. Okay, look, when it comes to recent advances, okay, so training, elite training is a art. There are so many of the trainers currently who say that I'm a high performance trainer, I'm a high performance trainer. So the art is understanding the sport, and the science is how to impart the sports science. When it comes to sports science, you have to deal with exercise physiology, you have to deal with sports nutrition, so that is very important. You have to deal with biomechanics. I'm sure Dr. Gagan, who's going to take an introduction to sports biomechanics. So biomechanics deals with movement science. So that is something which the physical directors has to be having a good understanding. The fourth important part is recovery. So role of a physiotherapist or a massage specialist is very important. Okay, so because elite athletes constantly travel and constantly take part in long durations, and they will be putting in high intensity effort, and as a result there will be a lot of the recovery, the muscle recovery has to happen in a very faster manner. So that is why oh sorry, the screen is moving. Unfortunately I'm not able to have a stand. Okay, I'll try to keep it. Yeah. When it comes to recovery is again very important for elite athletes, because especially for the club professional players who are constantly traveling, they will have to take part. Say for example IPL, a Kohli or a Dhoni, they will be constantly playing today. They'll be playing a high intensity match in the night, and then they need to catch a flight in the night time, and then they need to travel to another city to take part. And the recovery period is very less. So this is something that you will have to keep an eye on. Okay. So recovery part has to be handled well. The other recent advances I would like to stress, or you can train the athlete in hypoxic chamber. Okay, hypoxic chamber. Concentrate on precision hydration. Okay, the hydration is very important. So hydrating especially during summer times in India, you'll have to check for the sweat test. Okay, so how athlete can sweat profusely, and as a result he will be losing fluids and electrolytes. So as a result you need to replace those. So sweat test becomes very important. Mental skill training, sports psychology is very important for elite athletes to perform at an elite level. And I will also stress on the importance of biomechanics. So gait analysis and movement analysis, 3D gait analysis becomes very important. Okay, so I would like to summarize some important points. So the basics of training an elite athlete are, you will have to have a good training chart. So the difference, as I said, is quantitative and qualitative. Remember, the physical directors are good in qualitative analysis. So you will have to equip yourselves with a quantitative analysis. Before you give any exercise program to a professional athlete, always it is very important for you to do an assessment and have the data with you. Okay, so that data need not be a hi-fi analysis software or anything. Basic physical testing, basic physical testing itself would do. Okay, but data is very important in testing, so that you will have an understanding how much the fitness level has improved. So if you look at the fitness components, the important fitness components you'll have to be aware about is, one is the endurance level. Okay, second one is the strength, third is the power, fourth is the flexibility, and fifth is speed, and the final component will be the metabolic component. So when I talk in terms of metabolic component, the metabolic component, whether if it is going to be a marathoner, then you have to train the aerobic component much more, and if it is going to be a sprinter, then you will have to train the anaerobic component much more. Okay, so these are all important basics which you need to be aware about it. Again, as I said, when you give a training program, please remember the basic principles like specificity. Give the training program according to the particular sport, then give a progressive overload. The third one is the periodization. So when it comes to periodization, as I said, it is very important, especially during these times of corona, after you because the athletes might not have trained adequately before when the season starts. Please put them on a testing. Okay, assess their testing level, check for the cardiovascular status, check for the strength status, flexibility, all the fitness component before putting them on competitions. So this is very important. As I said, the advances part, recent advances like training in the hyperbaric chamber, precision hydration, gravity defying running, mental skill training, sports nutrition, biomechanics, 3D gait analysis, custom footwear. Okay, so these are all advances in the sports science component. So there is going to be a technique component and a talent component. There's going to be a sports science component. Okay, yeah. So there is a question which has come. Can you explain what is a progressive overload? Yeah. So when I talk in terms of progressive overload, which is an important principle of training an elite athlete, say for example, if you're having an athletic sprinter with you who is going to train at improving his speed. Okay, so if you constantly give a similar type of training, okay, so for sprinters there's going to be a combination of strength training, there's going to be a combination of plyometric training. Okay, so that has to be charted accordingly. So if you keep on lifting 10 kgs, then there is going to be a plateau. That is where the loading becomes very important. So after 10 kgs, you will have for 2 sets of 8 repetition or 3 sets of 12 repetitions, how much, whether it's going to be progressive or eccentric, concentric or eccentric, all this comes in sports science. Okay, so when it comes to progressive overload, please understand that athletes will hit a plateau if you are giving the same exercise programs for a constant period of time. That is why you will have to assess them periodically and then check that is why I stressed upon the quantitative analysis. So if you have a data, so today he is able to lift 3 sets of 12 kgs or 15 kgs, then next just increase the progressively increase it from 12.5 kgs. Next time you will have to definitely put him on 15 kgs and try to, if he is able to lift 4 repetitions or 6 repetitions. That is how you progressively overload. Okay, so there is another question from Deep on recovery from injury. Again, recovery from injury is very important component, especially for a professional athlete or an elite athlete. So this recovery can happen in multiple ways, either through physiotherapy. So we'll have to look at what type of injury. If it is a soft tissue injury, soft tissue means muscles. Hard tissue means bone and joints. If it is going to be a soft tissue injury, predominantly what might be required is after initial first aid of rest, ice, compression, elevation, then you will have to put him to some physical therapy, physiotherapy. Physiotherapy will typically, if there is going to be a muscle strain or a ligament sprain, you can handle with physiotherapy. The physician will supplement them with necessary medications, pain medications, or if there is a requirement for injection therapies. I would like to stress on a particular injection therapy which is very important. It is called platelet-rich plasma. Okay, so this is a very important therapy, especially for athletes who are not able to recover with physiotherapy. You can definitely try platelet-rich plasma with a qualified sports medicine physician who is trained to give these injections either for knee or shoulder, for elbow, or even for ankles. For any joint conditions, you will be able to give this injection. So this again will help in faster recovery from injury. Okay, there's another question which has come on training load and training volume by Shabir Hussain. He's asked what is the difference between training load and training volume. Yeah, good question, Shabir. So training load is basically how much he is able to that's what I said. If he's somebody who's going to do a weightlifting resistance training, then you will have to two sets of 10 repetitions or 12 repetitions. Training volume is that's why the basic principle you need to understand. The basic principle stands for frequency, intensity, time, and duration. Okay, FIT principle. So the difference between training load and training volume is there in the basic principle. Okay. There is another question on at present how to maintain metabolism. Yeah, especially at this point of time, during this COVID-19 and Corona times, it is very important you give the athlete some home-based exercise program so that he is able to maintain his fitness level. So when it talk in terms of metabolism, so muscle is an important metabolic organ. So detraining effect happens very fast, especially in elite athletes. So detraining, by what do you mean by detraining is, so the athlete would have trained for a lot of time and he would have got a good amount of muscle strength, muscle power. Okay, so detraining can happen very fast over a period of 4 to 6 weeks if he is completely sedentary and he is not doing any activity. So that is the reason you will have to give him a combination of strength training and a combination of cardiovascular training. That is how you can maintain the metabolism. I hope that I have answered Dr. Mamta's question. There is another question by Sataj Hussain, who's asking, sir, whether training should be taken into consideration of chronological age or mental age. Yeah, again, this is a debatable one, Sartaj. Okay, so mental age is something which is very difficult. So you're talking in terms of physiological age, or some athletes mature earlier, some athletes mature later. So the maturity rate varies from gender, females to male, and also even in a particular gender itself, that transition happens in a different way. That is where the role of physical director in assessing that athlete is very important. Okay, so if he is constantly improving, one important consideration is you will have to understand the skeletal maturity. So when you talk in terms of chronological age, you be looking in terms of skeletal maturity. So one constant question is, when is it safe to start weight training for young athletes? So young athletes, it is safer once, at least for I put my young athletes, especially at teenage group, once they reach the teens, 12 or 13, 14, you can safely start on strength training. But the reason is, one important component you need to look into is the safety quotient and the form of the athlete, form of the strength training. So it's very important that you don't start strength training at a very early stage, but when you start strength training, concentrate on the form and also concentrate on the safety net. Okay. So I think there is some more time where I will be taking all your questions. Some more important points I would like to give on training the elite athlete, especially when it comes to off-season and in-season training. Okay, so there is at this age of professional sports. So previously, all the sporting events 2 decades before was not so professional. Now with lot of club cricket, club football and all coming into play, there is a lot of money involved in it. So that is where we talk in terms of sport becoming a profession. So once sport becomes a profession, the athletes has to be handled in a very sensitive way. So because there are investors who are putting in money, and they don't want the athlete to either become injured nor their performance should not lose. So a team owner will always be giving impetus to the trainer to keep the athlete in the perfect condition. Okay, so I had that opportunity to be with the New Zealand cricket team when I was a team doctor for them. When in terms of elite athlete, that is where you can see the professionalism, because they used to travel with a sports medicine doctor, they used to have a sports physiotherapist, they used to have a nutritionist with the training with the traveling with the team, they used to have a strength and conditioning trainer, a rehab specialist, a video analyst. So these are all important cogs in a professional team. Okay, so if there is going to be money involved in it, yes, you can bring in a lot of professionals into the team. Otherwise, look at a state level, at a national level, the roles the physical directors has, especially at science, STAT, is very important, because you are the first point of contact for the athlete. You keep coming back to these 2 important words: identifying the talent and developing the talent. These are all primary job of this your designation. Okay, so this is where you will have to equip yourself both on the skill part and the other on the science part. So that is why I said training has an art form, training also has a science form. No 2 athletes are similar. Okay, so Roger Federer is vastly different from Rafael Nadal. Okay, these are all the top elite tennis players. Nadal's game is much more muscular. Nadal's game is much more physical, while Roger Federer will deal with much more finesse and technique. Okay, so when you train them, you cannot give one size fits all for all the professional athletes. So that is where for you to have an in-depth understanding of the sport is very important. This is a very, very important thing. Or you can talk all type of science to the athlete, but if you don't understand the sport, you won't be able to give a good training program to the professional athlete. So please please follow whatever sport you're going to give for the your athletes. So you should be well versed with the nuances of that sport. If you're having an athlete who wants to become a good soccer player, then you should know how to train a forward. You need to know what is the difference in training a forward, what is the difference in training a midfielder. If you're going to be training a cricketer, the training module for a fast bowler is different from training module of a spinner. The training module of a batsman is going to be different from training module of a wicket keeper. Okay, so there is definitely a lot of subtle differences. That is where you need to understand something called sport specific training. Okay, sport specific training is very important. So giving long for a weightlifter or for a sprinter, asking him to run for long hours is not going to help him at all. You have to specifically train him for his particular activity. Okay, so sport specific training is very important when you're going to train an elite athlete. So that is something which you'll have to keep in mind. Again, at this point of time during Corona and COVID, there is another important thing which is called functional fitness. Okay, functional fitness, please understand, functional fitness is something which you can give home based exercise programs even during these period of lockdown, because I don't see any improvement which is going to happen where gyms are going to be closed and there's going to be social distancing for so long. I don't think it is immediately your athletes are going to be allowed to train in an indoor component. That's why I told during Corona time, the first training module is going to be open in outdoor. The indoor is going to be gyms, indoor gyms and all is going to be opened at the last. So currently, if you have an athlete, I would say give them a functional training program. You ask them to train with the body weights, ask them to train stair running, stair climbing. You have to understand how to give an exercise program for upper limb, how to give an exercise program for lower limb, how to give an exercise program for back and core. So all these components can be given even without the support of a gym in a home-based exercise program. That is called a functional training program. On top of it, they will be mentally stressed. At this point of time, athletes all will be wondering when the season is going to start, what will happen to my professional career. So please look after the mental health also. Keep motivating them. Keep motivating the professional athlete, saying that this thing will normalize over a period of time, and then again we'll all be back to playing professional sport. So pep talk and motivating them is very important. So don't ignore the mental health of the athlete. Okay, so at this point of time, definitely they will be stressed in the mental health, and please look after the mental health also. All right. So I'd like to summarize, because there are a lot of questions coming. I'd again like to thank Dr. Prish Jain and Physical Education Foundation of India for this wonderful initiative, because I'm seeing a lot of varied talks, right from obesity to the mental health to nutrition, and we are going to have professionals from Indian Society of Sports and Exercise Medicine also coming and giving a lot of lectures. So this is going to be a very good initiative by PFI, and I congratulate them. Now I would like to take up all your questions, because there are a lot of questions which have come. Okay, so there is a question by Deepanshu Jadan, who is asking, sir, is a sports physiology covers the aspects of exercise physiology? Yes. Okay, so I'm in Chennai, and we're going to, in our medical college in Chennai, it's called Saveetha University. We are going to start MSc in exercise physiology and sports nutrition. So definitely sports physiology covers every aspect of exercise physiology. So please understand there are three components. One is the physical activity, that is the first component. Second one is exercise, and third one is competing performance level training. Okay, so when it comes to physical activity, we have to give a normal walking, going to job, cycling, everything is physical activity. Everybody has to be physically active. Second one is giving exercise, structured exercise program, which everybody has to do either in gym or doing running. That comes under exercise. Competitive level is a different. So that is where exercise physiology really plays a part. So exercise physiology or sports physiology will deal with checking the VO2 max in the cardiovascular system, assessing the strength of the particular muscle group. So exercise physiology and sports physiology has so much role, and yes, sports and exercise physiology are both the same. Okay. There's one more question by Sataj Hussain. He is having a confusion regarding whether you can say athlete is a product of heredity or training. Yeah, good question. So again, previously we used to say, because if you see the history of Indian sport performance over a period of time, we have underperformed for such a big population in Olympic level and world championship. Definitely we have underperformed. So if you say that whether we are genetically weak, I don't accept this, or he's asking whether it is due to poor training. I would say definitely the second one. Our training module has not, we are currently starting to compete with the elite, the Europeans and the Chinese, because our awareness towards sports science is improving and we are able to compete. I'm pretty sure over for certain events like sprinting, whether it's a 100-meter sprint or in those conditions, yes, there are reasons to believe that certain genetic traits will be of advantage. But for a sporting thing, I don't think for us to be in the top 10 for being in FIFA ranking in football, or again to reach our pinnacle in hockey, there is no genetics involved at all. When the sporting activity involves extreme physical conditioning, like 100-meter sprint, yes, there is some amount of genetic play which is there, and that can be, I'm pretty sure, as sports science develops, even that can be overcome. Okay, there is again a question by Dipanshu again. Due to this pandemic, there will be a mental strength in the mind of athletes. So, will it affect the performance of athletes in future? Yeah, good question, Dipanshu. Again, yes, definitely. If you're not motivating them, look, this pandemic has definitely changed the whole outlook. Not only in sports, our whole lives have gone for a change. So there is definitely going to be pre-corona and post-corona only. So there is no question about stress not being there. Yes, sporting industry, again, sports has definitely taken a hit, and that will all be started only at a very last stage. That is not prioritized right now for the government. Especially the professional athletes will be at a lot of stress. They'll be thinking about their income, they'll be thinking about what will happen to their career over a period of time. But you'll have to understand this pandemic will go away after a period of time, and we follow social distancing. There is going to be some changes in the spectators and positioning and everything, even in the training modules. Definitely you will have to handle their mental stress by motivating them and asking them to be well prepared physically also, so that once the competition starts, you can test them, check their status, physical and mental status, and then again put them back to the competitive levels. There is one more question describing the principles of sports training in detail by Avinash Kumar Sharma. Avinash, I think I have broadly covered on the principles of sports training. So remember this mnemonic set principle. Okay, so there are two types of training: training for fitness and training for performance. Okay, remember Avinash, there is two types of training. Training for fitness is something which you give for the common people. So that is where you'll have to remember this formula of fit: frequency, how long, how many days in a week that he has to do cardio, intensity, how much he can push, how fast he can run, type of training, whether it's strength training or whether it's cardiovascular training, duration, whether it's 1 hour, 2 hours. That is, fit formula is for training for fitness. Training for performance is, you will have to have these principles in mind. Okay, so that is specificity, periodization, Okay, specificity is type of sport they have. You have to give the training accordingly. Periodization, as I said, off-season training, in-season training, progressive overload so that the athlete doesn't hit a plateau. He has to keep on improving his timing and improving his performance. That is progressive overload. Then only the positive adaptation will happen. So periodization will be further subdivided into microcycles, mesocycles and macrocycles. Remember, in corona time there is a long gap between competition. So we are all currently, all sports persons are there in a macro cycle. So at least 3 to 6 months there is no competitions which is going to happen. So this is the time you will have to, whatever the athlete has been lacking, you can train him at this point of time. Unfortunately, the gyms are not open, so you have to find other ways of training the athlete, especially functional training. Okay. Dr. Mamta Jaiswal has asked about some points on sports drink and electrolytes. Yeah, very good. Look, sports drink has become an inherent component, Dr. Mamta. So, pretty much if you see any sporting athlete, whether it's racket sportsmen like tennis players, badminton players, or whether it's a cricketer or soccer player, any athlete, any activity which will extend over a period of time with severe intensity, yes, sports drinks like faster Gatorade will definitely help in maintaining the electrolyte status. Okay, so that is why the recent advances like sweat test, where you measure the precision, so it comes under something called precision hydration. Okay, sweat test, you measure how much the athlete is sweating and then give the adequate replacement. Yes, in training in our sort of weather, hot weather will definitely require adequate hydration, and for that sports drinks and sports drinks will definitely play an important part in maintaining the electrolyte balance. New dimension, interesting question by Jatin Soni on new dimension of sports technology, record telecoaching. Yes, correct. Sports technology is a fascinating new recent advance. Okay, so that is where you people all have to be well versed with it, how to give a training program online, because gyms might not be open. There will be a lot of numbers will be prohibited to train at the same time indoors. So how do you do that in these times of social distancing? Is through telecoaching. Definitely you should be well versed with all the technology aspect. Unfortunately, I'm not able to hold the camera properly because I'm not so well versed with this technological things. But you definitely should be well versed with the technological aspects, because that is where the recent advances in training elite athletes are moving in. So sports technology in training elite athletes plays a very important part. Okay. Any more training of physical questions? Yeah. So let's see any more. We will take some more questions. Yeah, so Sartaj has one more question on kindly say what is the age where we can identify talent of an athlete. Yeah, so this is a tricky question, Sartaj. Identifying talent, you can it is very easy to generalize by saying that he is talented, he can perform. So that those are all generalized talent terms without evidence. So that is why keep coming back to those two aspects, qualitative and quantitative. So coaches and trainers has to be equipped. Coaches will be looking at the quality part, and the trainers will be looking at the quantity part. Physical directors has a unique advantage that you can handle both the components, both the you will be handling the coaching component, and also you'll be handling the training component. So the physical directors are the single most important cog who will identify talent. Okay, so at what age depends on the sport. Look, sport like gymnastic, which will require flexibility, you will have to identify the talent much early, 4 years, 5 years. That is the time when Chinese gymnasts are put into training, because the ligaments, the soft tissues, muscles, everything has to be trained at a very early age for you to perform the flexible maneuvers. So these are all things which you have to identify the talent at a much early age. But at sport like cricket or a hockey, you don't need to identify the talent at a very early. I hope I'm live again. Yeah. So again, to finish up on the talent identification, sports like cricket, team sports, you don't need to specialize at a very early age, and you can even the late teens also you can specialize. Okay. So talent identification depends on the particular sport. That age will vary. Hope I'm on live. Amit Kaur has asked a question. Yeah, good evening, Amit. Identification depending upon quantity and quality and different sports. Yes, yes, Amit. Talent identification, as I said, depends on the particular sport, will vary. Okay, so depending upon if it is going to be a flexibility based sport, you'll have to identify that talent at a much early age. Or team sports and all, you can that age can vary from age groups over sub juniors, under 15, under 16 to under 19. The identification can be done. Dr. Mamta has asked one more question. Do agree that athletes should keep the records, food intake, activities, and changes they are facing now, so that it would be easy to gain health. Yeah, definitely data is very important when you are training an athlete, whether it's the dietary data or the training data. Definitely you should have the details with you. Okay, so for sure you should the data plays a very important part in training professional elite athletes. Any more questions? So I think my email ID is there. You will, any doubts I'll be happy to help. I think the poor connection, we missed out on quite a few questions. All right. Thank you, Dr. Mamta, and thank you, Amit Kaur Sachdeva. Thank you. Any more questions? I think we have some more time, maybe 5 minutes. Can take few more questions. All right, so these are I'd like to summarize by suggesting these are all tough times, especially for professional sporting athletes. So you will have to, as physical directors, coaches, and trainers, it is an important job for you to look after the athlete's physical and mental health. Okay, so find innovative, if you ask me, find innovative ways of training the athlete. Okay, it need not be traditional type of training. The traditional type of training will be very difficult in the coming months and coming days, with no gyms and closure of lot of sporting academies. Okay, so especially during the corona times, you have to find innovative ways, new ways of training. That is why keep updating about the recent advances in sports science for you to train the professional athlete. Yeah, so Satyam Shukla has asked, what are you doing in lockdown? As a doctor, I need to keep working. So yes, we are still working during this lockdown. Yeah, yes, Satyam. How there's a question on how COVID affects sports. Definitely, yes. The COVID affects sports in multiple ways. It affects the sportsmen, it affects the coaches, trainers, it affects the spectators, it affects the business module. I would say, just like our whole life is going to be changed, I think sports also has taken a very big part. Unfortunately, sports comes under the non-essential part of it. This I feel is unfortunate. Whether it's an ignored commodity. I was happy that the Ministry of Youth and Sports Affairs has initiated a lot of programs through SAI and other components. Sports has to be an important component to bring the population back out of this pandemic. So physical activity, exercise and sports has to be given top priority, if you ask me. This question of what kind of workout we can do, especially during the lockdown. Yes, that is why Kirtivasan, you'll have to find innovative ways like functional training. Okay, functional training plays a very important part where you can utilize your body itself, body-based, floor-based training like push-ups, squats, lunges, depending upon what sport you play, what sport you're going to train. If the athlete is going to take part in running based component, then you'll have to find ways of keeping his cardiovascular component also in fitness. So he can try on the spot jogging, he can try skipping. So these are all small changes you'll have to find. There is no one size fits all, especially after corona. So you'll have to innovate and find newer ways to do the training. Maybe one last question. Anybody? Yes. Hamstring problem में exercise करना चाहिए. Yes, Sanjeev Kumar, I know hamstring injuries are very common in sports. So the most important preventive measure will be stretching and strengthening the hamstring as a group. Okay, so there is a lot of novel scientific trainings like Nordic hamstring training, Nordic, Nordic. Okay, so these are all exercises which will help in preventing hamstring strains from happening. If the hamstring problem is already there, I would recommend you to see a sports medicine physician or a physiotherapist who can diagnose and treat it accordingly. Yeah, Amit has another question on circuit training during COVID. Yes, you can do, Amit. I think during Corona, circuit training, provided you have the space. Yes, different circuits can be kept. A combination of agility drills can be done. A combination of speed and flexibility can be done. So that circuit training can be pretty much done even in home. So you need not have a sophisticated gym or anything for that. Any more? Yeah. All right. I think this comes to the conclusion. I would like to conclude again by congratulating Physical Education Federation of India for this wonderful initiative. In this coming days, we'll try to cover a lot of important topics on sports science and also the art. So please remember, there is an art to training, there is a science to training, and physical directors is in a unique spot where you can be good in both. Right? Cheers and Jai Hind. Thank you.